is central to healthcare practice and education. In fact, it is reflected, the spiritual element of the care that we provide is reflected in our code of ethics, patient charters, and reports that demand that we should provide holistic care, which is person-centered approach to care. This would mean that our care would need to address both the physical, the mental, and the spiritual elements of the human being. There are, with regards to, however, spirituality and spiritual care, there are many issues like with any other topic, and which I would like to discuss with you. For example, one of the main issues is whether there is need to teach spirituality and spiritual care to undergrads or postgrads, students or staff. Because one of the researchers, and she wasn't only the only one, quite a few researchers state that the spiritual element can actually be caught when the person, the student, right, is in the clinical area, rather than being taught in the classroom or in groups. This argument, however, which was presented, one of the main authors that presented this argument was Bradshaw in 1997. She said, well, students learn from role models. Okay, we cannot dispute, and let's hope it happens like that, that students do learn from role models. However, they learn good practice if the role model is practicing well. So in view of that, unfortunately, sometimes role models do not provide care appropriately, so addressing the spiritual element appropriately, or maybe sometimes it is missed. Actually, we cannot rely totally on what they catch from role models in the clinical area. So it is important that the student, as part of component in the curriculum, all right, part component, there should be this explaining and teaching the students about spirituality and spiritual care. In fact, so Bradshaw's argument was disputed by many researchers, such as McSherry in 2006 and others. And in fact, research shows that when students were taught in the classroom, in the faculty, about spirituality and spiritual care, actually their performance was better in the provision of spiritual care. So the message is that across the globe, this element of care, so that it will be given equal importance, like addressing physical needs or psychological needs, it needs to have an input into the curriculum. There are barriers to the provision of spiritual care. Well, the barriers that are documented in the literature, that is what the research has shown, was that, for example, they find difficulty in defining spirituality because of a lack of a consensus definition. Nurses, the research says, the results, that unfortunately there are no clear guidelines for the nurse to address this need. Furthermore, there is also the ambiguity within the healthcare professional role, whether it is their role or maybe it is somebody else's role. There are also barriers with regards to staff not being in touch with their own spirituality, resulting in imposing their own spiritualities if they don't know that, yes, everybody has got his own spirituality, including the healthcare professional, but it's important not to impose it. So what happens is if they don't have this knowledge, right, then there are problems. There are also misconceptions about the nurse's or midwife's role or the healthcare professional role in providing spiritual care, and the lack of competence and knowledge which makes them avoid spiritual matters. Because there is lack of knowledge, certain situations where perhaps spiritual care is needed more, right? Like, for example, somebody facing a difficult situation, getting a poor diagnosis, right? What happens is that when there is lack of knowledge, healthcare professional tends to avoid going near the patient to discuss and to go through them, to help them out, to help them with their innermost concerns and thoughts. So it also, nurses would avoid such situations. Basically, the bottom line is that they lack knowledge or how to cope with the situation. So usually this is due to lack of training and education on spirituality, both in the undergrads and postgraduate situations. Competencies. When we talk of competencies, now competencies or a competency-based approach is quite popular, particularly in Europe, with regards to the approach to education. This was part of the exercise through the EU in harmonizing education. So most of the programs address the competency-based approach. So what is competency and what is being competent? Well, to be competent in anything, including, so there are spiritual care competencies, but there are in any competence that is required in nursing, midwifery, or in any other discipline, requires that to be competent, you need to demonstrate three elements, basically. It is the cognitive, the knowledge that the knowledge behind this particular practice you are doing. There is the functional, so that functional or dexterity, how to do it. This pertains to the skill. And there is also the ethical competency. This involves attitudes, how you behave, personal values. So to give you an example, if a student wants to learn how to monitor the blood pressure, all right, she must demonstrate that she knows the knowledge that is necessary with regards to the blood pressure. She has got the dexterity, how to monitor it, and she also has the right attitude. For example, informing the patient about the result, giving advice, and all this. So that is competency, what we understand by competency. So competency can be regarded also to provide a benchmark against which a performance may be measured. In fact, they have been described as the backbone in harmonizing education. So, what are therefore competencies in spiritual care? And here, and I'm going to give you some example, I have to refer you to a project, and a new project that was performed between 2016-2019, which actually worked on a set of competencies. Prior to this project, there was literature and competencies were compiled. It was part of my work in my PhD work, and other authors that have produced competencies in spiritual care. So having the literature, this project brought together 4 main spiritual care competencies. They are the core competencies. They were compiled reflecting the spiritual needs within Europe. Okay. In fact, when we speak about competencies in spiritual care, as a result of this project, and there is also a book that was published after, we can identify 4 main competencies, and these are the intrapersonal spirituality, interpersonal, assessment and planning for spiritual care, intervention and evaluation. These are the 4 core spiritual care competencies. Now, each competency, as I said, must have the knowledge element, the functional or the skill element, and the attitude. So, for example, the intrapersonal deals with yourself. The interpersonal spirituality deals with how you provide spiritual care, assessment and planning for spiritual care, intervention and evaluation. So to have an example, let's just say the intrapersonal spirituality, this is an example. It means is aware of the importance of spirituality on health and well-being. So that is the competency. What is the knowledge? So which is important within this competency? That the students understands the concept of spirituality, all right? When how does she does this, you know? So now the skill element, okay? The skill element involves that she reflects upon her own values and recognizes these as different from being different from persons. And she takes care of herself, of oneself through self-awareness. And if we, an example pertaining to the same competency with regards to the attitude would involve dealing with herself and the others, for example, that she is open and respectful to diverse expressions of spirituality. Okay, so altogether, this project has brought about, all right, compiled together 4 core competencies. It's easier to remember 4 competencies, but each competency even can be used as a learning outcome, right? Each competency will have the knowledge part, what the student is expected to know, the skill part or the functional, what she is supposed to do, and the attitude, all right, how to behave in that situation. So if you look them up, right, if you look them up, I think it's worth looking them up in fact, and even looking up for the book where there are a lot of explanation with regards pertaining to these competencies. It is one of the very most common and popular argument with regards to this dimension of care. Obviously, spirituality is a complex concept because it originates from different philosophies. For example, the philosophy of caring, which embraced the concept of holistic care as the central core value of it. There are many definitions, you know, but basically, you know, in each one of them, you find a lot of elements and characteristics that are common. For example, there is this variation is because spirituality in itself within the concept is rather personal, okay? So with it, it brings along, spirituality depends on worldview of the individual. Therefore, it is quite personal and subjective. So one of the reasons why there is no universal definition of spirituality, there are many, but they all focus on helping out the patient depending on his or her personal needs. For example, spirituality may or may not include religion. In fact, very often there is this confusion that spirituality is religion or religion is spirituality, right? But this depends on the worldview of the individual, because spirituality and religion are sometimes perceived as separate. But we have to say that they are connected entities. Why? Because since spirituality depends on the world view of the individual, people that belong to a religion, right? And religion is important for them. So their spiritual needs will actually focus a lot about their religious beliefs. However, everybody, being an atheist, not believing in anything, everybody is a human being and everybody has got his spirituality. So rather, spirituality is more open to everybody, but it also, within it, people that have a religion, that's why they are connected entities, all right? So spirituality, although it's subjective, it exists within and outside the religious system. So that is why some authors think that it also complicates the concept. In fact, some examples of the definitions that we have, for example, Pokalski talks about living according to one's beliefs and values. Others, spirituality means finding meaning and purpose in life. For some, a connection with a higher power. Thus, spirituality has no definition on which all agree, but many definitions in which we all can share. This may be due to culture, upbringing of individuals, and life experiences. Whatever it overall, all right, all these definitions, whatever they are, the focus is on helping the client, the patient, the woman, whoever, all across the lifespan continuum, helping them with their innermost concerns, helping them with being present, helping them with listening, right? So this is why it is such an important dimension of care. And the provision of holistic care cannot be complete if this dimension is not provided. So this is only the time that I had allowed for discussing a bit some issues with spirituality. Thank you very much and wish you all the best.